Welcome to the Remarkable Dentist Podcast with me, Fred Joyle, where I interview amazing dental practice owners digging into their successes and failures, their insights and hindsights, getting their views on where dentistry is going, and discovering what it took for them to become remarkable. Hi, I'm Fred Joyle. Welcome to the Remarkable Dentist Podcast. Once again, I am talking to a really interesting and successful dentist who has a great story. I'm really interested in hearing his journey from being an associate to ownership at a fairly rapid pace. His name is Dr. Jordan Tucker, and we're going to be talking to him and finding out how this happened and all the challenges that he faced. Jordan, welcome to the podcast.
Hey, Fred, thanks for having me.
So you may be the youngest dentist I've had on the podcast, which is great because I think young dentists are very interested in what the heck they're going to do when they get out of dental school. So I'm going to ask you first, what got you interested in dentistry to start with?
Yeah, absolutely. What got me interested in dentistry, I would say, was the hands-on approach of working with your hands, the people skills and interaction with people on a daily basis, multiple different people, and the sense of satisfaction and being in control of your career, of your life. Not a whole lot of careers offer all those things, and dentistry was the one that hit the nail on the head for me.
And so there's no family background of dentistry, no parents, grandparents that pointed you in this direction?
Yeah, I wish that would have made it a lot easier when it came to ownership. But no, my grandfather on my mother's side was a old country doctor. And my grandfather on my father's side was a coal miner. And so not a whole lot of dentistry background there at all.
Now, would you say country doctor? We're talking about house call kind of guy, right?
House call
in a small town. Give me the dimensions. This was West Virginia.
Correct. Yes. Very small town. I would say I wouldn't even know a number to put on it now, because when he was there was the pinnacle of when the coal mines were operating and the town was hustling and bustling. And today there's very few people remaining there. But the type of doctor that drove to your house, delivered a baby in the middle of the night, got paid with eggs and apple pies, and woke up and did it all again the next day.
Not bad currency when you get down to it, but it's hard to build a retirement plan with that. But that's so great. That's such an interesting time period in America that was happening. And so, but from that, now it was your father's father that was a coal miner?
Correct.
Okay, so your dad became a professional, though, didn't he?
Exactly. Yes. So my father is an attorney. Yeah, he is an attorney.
Now that's a pretty good transition. So that's another great American story. Is the dad works hard. That's about as hard as you can work. Coal mining. Yeah.
Right.
And his son manages to get himself through law school and become a successful professional. And now his son is the greatest profession of all time, dentistry. So,
yeah, absolutely.
So where'd you go to school? Give me the educational background on you.
Sure. Yeah. So born and raised in West Virginia. Undergrad was at Shepherd University. I played football there, actually, and dental school was at West Virginia University. And as far as the education goes there, Shepherd was a very liberal arts type of school, and not the huge classroom size that you would get at a lot of major universities, which, playing football and trying to get the grades to get into dental school, I think would have proved much greater of a challenge in a classroom where you're one of 300 kids versus having the opportunities to speak with the teacher and get extra help if needed in those more difficult classes that wouldn't be an option when you're just a number in a classroom where you're just a number versus knowing the students by name. And then West Virginia University and dental school was, I would say, fairly smaller class size as well compared to other dental schools. We had, I think, 54, 53 kids when we started in my class, and great hands-on experience. I don't know what it's like at other dental schools, but West Virginia has a reputation for not having the best teeth. And what better place to go learn to fix teeth than a place like that, right? So I graduated dental school with a lot of experience doing multiple procedures that a lot of dental students don't get the opportunity to perform in dental school. So very, very fortunate to have that background.
Yeah, and last year, 2020, was a terrible year for a lot of dentists who were D4s, and because their residency, they get very little practice. A lot of them, some of them, did maybe a couple of crowns. You probably did 30, 40. You did extractions. You did partials. You got real good hands-on training because of the size of the school.
Absolutely.
And
yeah.
A lot of dentists are getting that when they become an associate. They really don't develop the skills and the experience of dealing with that many different types of cases, because everybody's a little different. And if you're presented with people with neglect, you're going to learn something. So
a lot.
Very interesting that was your pathway. So then you were you on you're in good shape. So I'm believing there's a football scholarship in the mix here somewhere that that helped you with your college. Is that true?
Yes, absolutely. Yes. Was on scholarship, a dual scholarship actually. So football scholarship, so athletic, as well as an academic scholarship. There's a program in West Virginia called HSTA, HSTA, stands for Health Science Technology Academy. Long story short, it gives students an opportunity to have all their tuition, both undergrad and professional school, paid for if you go in state for school. And there are certain requirements and measures you have to meet through high school and college in order to have that granted to you. But very fortunate to be a part of that program and have that opportunity.
Yeah, that sounds fantastic. It's so interesting how sometimes that specific thing exists that gives you just a better track, just a higher quality education. I mean, I look back personally, my high school was so rigorous in my education that by the time I got to college, I was way better educated than the freshmen and sophomores that were in college. And it was in Boston College. It wasn't a community college or something like that. It was a hard school, but it was the opposite of what you're talking about. I mean, my first classes, 400 or 500 people in my freshman year in that class. Right. The professor was a tiny little figure at the front of the room. I never got to know him. I actually switched to the University of Rhode Island after 2 years and really got to know professors. They actually became my friends a lot of times. Sure. And that made an enormous difference in my education. We're going to circle back to some of the people that influenced you along the way, but I want to hear what you came out and you became an associate. So talk about that.
Sure. When I graduated dental school, looking for associate opportunities, and ended up in Greenville, North Carolina, where I worked for a year in a group practice. There was 3 offices three owners, doctors, and myself as an associate. And I worked out of two offices. One of the offices was very similar to my experience at West Virginia Dental School, where it was a rural area where the patients more or less were like, hey, doc, if you're not going to do this, I'm not driving all the way to Greenville to have it done. You're just going to have to pull the tooth out, that kind of thing. So got a lot of great experience there in that environment, doing all kinds of different procedures. And you kind of figure out what you like, what you don't like. And, you start to think what your time is worth, and not doing a procedure just because you can, but doing a procedure that's going to be an efficient use of your time, and great and invaluable experience in every facet of dentistry, from the time management side to the procedural side, in that town and in that associateship.
And then you jumped to another practice. You moved again, right, into a practice in Morgantown?
I did, yes. Moved back home, closer to home, and practice in Morgantown, where I was introduced to Dr. Robert Martino and his offices there, and was introduced to Fortune Management and the way that they operated practice. And from a employee side of things to the patient side of things, it was a complete night and day switch from what I had grown used to in North Carolina. And I was impressed, I think is the best word there. Very impressed. I was happy to be a part of it. And it's where the seed was planted in my head that if and when I ever become an owner, that this is a good way to do business. This is a good way to operate things from a day-to-day standpoint.
Yeah, the systems that Fortune brings in, and just having coaching. A lot of dentists don't learn early on the value of coaching, which is kind of unfortunate, because you don't have to reinvent the wheel on a lot of this stuff. It's been done. There's a lot of confusion. People talk about being a dentist is you're an entrepreneur. It's like, no, an entrepreneur kind of invents a business pretty much from scratch. You may be pulling things from various things in the environment that he or she's learned, but they got to create a lot.
Sure.
Dentistry's, it's all been done right. This is just finding out how to do it right. You don't have to be an entrepreneur. You can just get some coaching. Now, I'm going to reflect back on your football days. I think, did you have what you felt was strong coaching in your high school years?
Absolutely. Yes, absolutely. In high school and even more so in college. In high school, we had great coaching. We were also blessed with a number of very successful athletes that were just happened to be born in the same town in the same year and play on the same team, and achieved a lot of successes together. Of course, a great coach, brings all those individuals together to perform as a team. And then in college as well, Coach Monty Cater at Shepherd, excuse me, has a record for, you have to double check the history books here, but the most active winnings coach among all levels in college football, something along those lines. Very, very instrumental, very inspirational individual, and that I was honored to have been coached by, and left a huge impression on me, and how the right way to do things from a team standpoint. And those, I think you put your blood, sweat, and tears into something for a certain amount of time, and whether you like it or not, it's a part of you. And I'll tell you this, being in the boss of a lot of females, you learn that you can't maybe handle things. So you have to kind of dance around the wording and how and delivery of how you would say things compared to a football team, obviously. But the main ideas
Yeah.
and the principles are the same.
I'm picturing that certain verbiage would not fly as well in a dental practice. What coach would be yelling at you on the sidelines and in the lineup, So
luckily, I wasn't the guy
room.
that got yelled at very often. But when I did, I learned from it and made sure I did what I could to not let it happen again.
Yeah. So that's great. So now you're working in Dr. Martino's, but he had multiple practices at that time, correct?
He did, yes, multiple practices, and the way it was set up, you're very what's the word? I guess chaperoned when you got started, in terms of there was multiple different owner doctors and that were great at certain areas of dentistry. And if you wanted to learn more about doing root canals, we'll go to this office in this town. You'll spend a week with Dr. So-and-so, and he'll walk you through, how he was able to be successful doing root canals the way he does. And then if you want to learn about implants, so we have another doctor in another town that's really good at that, and go spend a week there. And if you want to know about business, give Rob a call, and he'll tell you all about it, what he knows and what he recommends, and what another invaluable experience to draw upon when I was taking into consideration the future endeavors of being a dental office owner.
Now, was Bobby practicing at that point, or had he stopped already?
Oh, how long have you known Dr. Martino?
Probably 10 years at this point.
How long of those 10 years had he been practicing?
None.
Okay.
No, he'll tell you, he says, as a dentist, I'm a terrific CEO. It's that he's very passionate and very good at the business side of things. He's just a very smart businessman, but he learned a lot. He saw what systems worked and he incorporated them into his practices. But I love this idea that you tapped into this thing where you could just rotate through offices and get this very advanced, very localized and very focused clinical training. That's an accelerated program if I ever heard one. That's certainly a blessing, and it puts you in a position where you could branch out and start your own office, which is the next step, right? You finally decided that had to happen, and there were a couple of factors involved in that, correct?
Oh my, yes. And I would say too, being in a position where you're a dentist taking time out of your day to show another dentist these things, I think is a factor of success. Success allows certain opportunities to people. One of those is time. And, you can go through the busy hustle bustle of the day and not take time for anybody else or anything else other than, what's on your schedule and what's going on in the office in that day. But when you can almost turn around and reach back and help the next guy coming along kind of thing, there's a lot to be said about that. And that was huge. And just a representation of doing things the right way, how to do things the right way. So yes, took those experiences and moved to Texas and was looking to become an office owner after a brief stint at a corporate office, a brief stint, a year and a half or so, a little longer, almost 2 years, and was another night and day flip from doing things that I'm impressed by when working with this group that I'm impressed by, to working in an environment that was, it seemed, unorganized and very hectic and stressful, and maybe motivations weren't in the right places as they should be from a lot of people that were making the decisions. And very, very eye-opening into, hey, dentistry isn't just this, single entity and this is what it is or what it isn't. It can be a plethora of multiple different things. And you're only in control of that if you're the owner of the office. That's the main takeaway that I got from that. So if I wanted to do things a certain way, that was only going to happen if I was the one in control making the decision. So started looking for an office in Austin, and ended up just outside of Austin in a town called Pflugerville, and took over a practice that was started in 2008, was sold to a corporate office for about almost 2 years. And you take private practice patients and you throw in a corporate business model, and the result of that is a lot of them left. I took over after a lot of these patients had already left, and it's more of a de novo startup. I rebranded the office and completely, changed everything from the color of the walls to how we were doing business and the types of dentistry we were doing, and here we are today. But that was an adventure, from day one to now, that I'm sure we can touch on specifics.
We're gonna peel that open for sure. But another interesting thing that happened to you is you got to work with Bobby Martino, but really see how many things were done really well. And then you also, it's very instructive to go see things not done well. I mean, my experience in business, before I created 800 Dentists, my partner and I, we had worked in great businesses with great bosses and bad businesses with bad bosses, really badly run. Both of those things are incredibly instructive as you build your own business, because it's almost like dating. It's like you find out who you don't want to date just as much as who you'd like to be with. And so 100%. That's very good, as much as you probably didn't enjoy a lot of that year and a half or so in the corporate environment. You pulled a lot of information out of that you're going to carry with you for all your days, basically. But we didn't. Why are you in Texas?
So I ended up coming to Texas with my fiance, who graduated medical school, and her residency placed her here in Texas. So came along for the ride, and once we were here and kind of got a lay of the land and realized this Austin's not a bad place to be, we decided to plant some roots and buy a practice and do some permanent things. Thank goodness that the time of when we moved here was when it was compared to now, because I don't know if you've seen the housing market in the Austin area lately, but I couldn't afford to buy my house now if I had to.
Well, that's because everybody, is moving from California to Austin, and we think $1 million house is like a free house.
Right.
So, you can't get a decent condo here in Los Angeles for that. So they're selling their places and moving there, and they're going like, yes, I'll overbid this house. I feel like I'm underbidding. So we kind of exploded the market. So good timing there. Now, is your wife going to be a GP or what's her specialty?
Yeah, she finished up actually just this past this spring in emergency medicine. So she works in the emergency room where there's the patients need her, right? So it's a very different perspective from how she handles patients to how I handle patients, where more or less dentistry is viewed upon as elective, more or less, and in an emergency room, it's they're there usually because they're having one of the worst days of their life, right? So she sees a lot more gunshot wounds than you do, probably. So I hope I never see a gunshot wound.
So that's terrific, because I mean, you two great professions, but there's a huge contrast in terms of her career. But So she dragged you to Texas because you got to go where you got to go for your residency, right? That's my understanding of medical residency. So, and you got portable skills.
Right.
And so you are in Texas. What happened? How'd it go?
Right. Well,
how'd you pay for it? That's were you able to borrow money? Was that your strategy? People want to know how the heck do you buy a practice these days? So
yeah. Great question. Same as the housing market. The same thing was true with the dental market at the time, where corporate, private equity funded corporate offices were buying any office that was worth a darn, that was cash flowing, right, and paying cash above the asking price, kind of out competing the sole dentist who was looking at that same office. And it came down to what the seller's motivating factor was. If it was just, hey, this is my retirement, they didn't care who bought it, right? Or if hey, this is more to me than just dollar signs, then there was other factors that went into those decisions. But so with this office, because a lot of the patients left and it was not cash flowing, a bank would not fund that purchase. So we ended up doing seller financing and working out a note from that perspective. And I can say that what it paid for the office versus what it's cash flowing now was absolutely 100% not easy to get it there, but absolutely 100% worth it in the long run.
Yeah. So you basically bought a practice that was unappealing to corporate because it had been, corporate had declined it already, right? Corporate had come in.
It was owned by corporate. I bought it from corporate.
You bought it out of corporate. That's
right.
That's a great move. I love that.
Right.
And so, but after that, it was smooth sailing. Everything kind of all fell into place, right? That's as it always does.
Yeah. Absolutely not. I think there's you learn a lot about yourself too, because you are an individual and rely on yourself for a lot of things. Going through college and your grades are. You can't blame anybody but yourself, right? If you're not making A's on the football field, you can't blame anybody but yourself if you didn't know the playbook, or if you didn't prepare for the team you were playing that week, or you didn't work out hard enough and workouts. And then when it comes to a dental office, you can't do it all. And I've tried. Trust me, you cannot do it all. You're so reliant on your team and the people around you, the culture, everything. And that takes time. That takes time to specify what it is that you actually want, because you go into it thinking one thing, and the reality of something is very different than the idea of it, and figure out you want something completely different than what you thought you wanted. And then you need to have people around you who are better at things than you are to achieve what needs to be done. Because if you're the best person for every job, then why are you paying those people to do it? You know what I mean? So not settling for something that's less than your ideal. Keeping faith and trusting the process, and one day that it all clicks.
So Gene Williams is your fortune coach?
Jennifer Surratt.
Jennifer. Okay. Yeah. Gene is the one that recommended that I interview you. That's why I'm thinking that.
I work with Gene. I've worked with Gene indirectly through Jennifer. But no, yeah, they're both phenomenal. Phenomenal.
And so did you bring them in right at the outset as you were acquiring the practice, or did you figure out you needed them at a certain point?
Yeah. So funny enough, I didn't know that I was experiencing the
benefits of fortune management when I was working with Dr. Martino. Never saw the coaches in office. Never saw the where things were coming from. I just knew that I liked what their approach to the field, and talked to Dr. Martino a lot in terms of, evaluating these practices and which one's a good one, which one's not, what's key things to look for, all those things when you're looking at buying a dental office. And that's when he told me about, Fortune and where to move forward with them. I think it was the second month in, because, when you start up a practice like that and you're not getting any working capital and things of that nature, you're looking at the bottom line very tightly and seeing what these expenses are. And, coaching, almost seems like, an
extravagance, right?
Yeah. That's a privilege. That's not a necessity. That's not a necessary expense. But I've gotten some good advice along the way. You can never pay too much for a good attorney. You can never pay too much for a good accountant, and coaching goes the same way. So despite, my inclination, I went ahead the second month in and started coaching with Fortune. And I'm so grateful, that I made that decision, because, going through the end of 2019 into 2020, and then everything that, COVID impacted all of us, and what to do and where to look and resources and PPP and all the different things that were going on. If I did not have a resource and a team to help me through that, being a new practice owner as it was, and not really knowing, kind of what was going on to begin before COVID, that was an invaluable resource to have. And I can't, don't think that things would have shaked out on the other side of COVID had I not had them. I'd say that.
Yeah, that's they had a very comprehensive playbook that they put into position very early on to help everybody through this, and the practices that applied it, really, they came out strong. They rode it out, and some of them had their best year because of it. So give me some of the challenges that you're facing now, like what a recent thing that's come up in operating your practice.
Let me see. Couple things. I would say, one, when it comes to your team, titles don't mean anything. Titles don't mean anything. Just because someone calls themselves an office manager does not mean that they're an office manager. So that's been huge. Is, not what's the quote from Winston Churchill? Trust but verify, right? Trust but verify. Another challenge is staffing in of itself in this market. Well, I think it's nationwide, really, that a lot of people are having trouble staffing and getting good staff and things of that nature. So that's always that's the challenge everybody's facing. My approach to that has been this, that good people like to work with other good people, and quite often I find that good employees feel very underappreciated in their efforts, when they know that they're the hardest working individual there, and that nobody else cares, and that they're just, the other ones are going through the motions, and they're passionate about it, and no one recognizes that. They just see them as one of the other clock punch in, punch out, and go about your day kind of thing. And if those people get an opportunity to work with other good people, and they're genuinely appreciated for the hard work that they do, you can find them. You can get them on your team. And usually that's through referrals, right? Because dentistry is so small. Everyone's worked with almost everyone in a certain town if you've been there for enough time. And you hear and who good ones are, who good ones are not. Things, the ball's in your court in terms of how you want to handle that hiring approach. And so we have different ways of doing that, incentives for referral bonuses and things like that. But I would say this, dentists that are listening to this, if you have good people on your team, let them know. Let them know that they're doing what's expected of them and meeting and exceeding expectations. And you're happy to have them on the team, because just a thank you goes a long way. Just a thank you doesn't have to be a huge bonus paycheck or anything along those lines. People just like to know that they're appreciated and that their hard work doesn't go unnoticed.
Yep. I remember an office manager telling me this story, is that she worked for a dentist for about 24 years. And every day at the end of the day, he thanked her for the work that she did that day without fail. He could be on the phone and she'd be walking out, and he'd say to the person he was talking to, "Hold on a minute." And he would say, "Angela, thank you. Another great day. Have a good night." She never forgot it, because he retired. She eventually had to work somewhere else. And she went like, "I don't get that anymore."
Exactly. And you notice it.
Yeah. Oh, yeah. So she's feeling the gap. She's feeling the absence of appreciation. It is one of the foundational tools of creating a great culture. And culture, as you're saying, culture attracts quality people and retains them. Because it's even better if they've been at some place where they went like, yeah, the money was all right, but I was never looking forward to getting there. You want a place where they can't wait for Monday, because they're going to see all their friends, and they're going to, everybody's going to get a lot done. And the day's going to go by like lightning, and everybody feels good about what they've done and feels good about working together. That's so powerful and so much more essential in a dental practice than a lot of other businesses, because you're in retail healthcare. You're you're dealing with people who are making all sorts of choices based on how much they trust you, and how good they feel in the office. We're just feeling creatures wandering through the world, and when you find a great dentist with a great team, you accept more treatment. That's the economic reality of how people behave. So
exactly. Patients don't know good dentistry from bad dentistry. They just know if you hurt them, and if they enjoy being there and in their experience or not. It's human nature. It's normal not to enjoy being laid back in a vulnerable position and have your head drilled on with sharp, objects. That's normal. That's normal not to want to.
There's nothing weird
strive
about
to
that.
Go to that. Yeah. But if you can make a patient laugh a couple times along the way and make their financing easy on them, and make them feel warm and welcome and cared about, and even patients appreciating them trusting you with their dental care because they have a choice, and just all those things. It's really easy to get overcomplicated in this industry too, Fred. I'll tell you that there's so many resources and answers of how to do things, and you can really overcomplicate it. You don't have to try hard. I struggled with that when I first got started, coming from, the experiences that I had and looking into, what you don't have to reinvent the wheel. Like you said, you don't have to figure this out how to do it. But you can pick from the playbook of all the other ways that people are doing things. And you figure out what works for you, what doesn't, and what you want, stick to your vision, and keep it simple. Keep it simple. Don't overcomplicate it. Because when it's overcomplicated, one, it takes too dang long to explain it to everyone else and sure. Patients too. And then that's just time. That just eats up time. And at the end, if they don't even understand it, what did you gain from that? Right. So keeping things simple, treating people the right way, patients and team, and everything else takes care of itself more or less.
So what do you think? Do you think what's next for your practice? Do you envision big changes, gradual changes, multiple facilities? What's your 5-year vision?
Yeah. Great question. And that's changed since you would ask me that question 6 months ago, probably would have had a different answer. My original point was multiple practices. I used to want to go down that road. And what I'm finding out is, like I said, I'm complicating things and it's way less complicated when you only have one compressor to worry about blowing out than 3 or 5, and you only have one office team to manage and deal with and employ, as opposed to 5 different entities working separately, 5 different teams working separately. And so what we're doing is that multi specialty practice under one roof. So we have some specialists that come in, an oral surgeon, an endodontist, and we try to make it so the patient doesn't have to leave our office for anything that they may want or need. Granted, there's going to be special occasions, if you're going to require general anesthesia for some specific oral surgery, or you're going to have to get referred, but the majority of times we don't have to do that. We keep everything in-house and try to make it a one-stop shop, for a lack of a better term. The newest thing is we just added 2 chairs and a C-rack. So that should, well, who knows with the backup in the supply chain right now when it's going to be delivered. But once it gets installed, looking forward to taking advantage of that for sure.
Yeah, being able to make those crowns right there is going to be a game changer for you. I love the idea that you figured out what a lot of dentists learn the hard way, which is 2 practices are a great way to work twice as hard for the same money.
Yes. Yes. Yeah.
And multi-specialty is absolutely a terrific way to go. And it's very patient-centric. As you're saying, it's like that. Make it so they don't ever have to leave unless it's really something specific. And you can explain it. You say, look, this is very complicated surgery. This is going to require going to an oral surgeon for this, or this root canal is something that I really want to send you to a specialist, a different specialist for.
Sure.
But technology is going to be part of it, and then all of these individual specialists within the facility. The more specialists you have there, the more you can actually create the consultation with the patient. You can say, look, I'm going to bring in our endodontist right now. And so she's going to talk to you just about why this needs to be done. Suddenly they feel like, wow, I've got a team working for me to make me healthy. It's very powerful. And it gives them a lot to talk about when they go out. First, it makes them loyal, but then they're out there saying, I've seen the new age of dentistry and it's fantastic. Dr. Tucker has a whole different approach to it, and I love it. So good for you. So
it speaks for itself. Yeah, it speaks for itself. Any patient hopefully has been going to the dentist the majority of their lives. It won't take long to realize the difference in one office compared to another. That it doesn't take long. If you're left in a room by yourself for 30 minutes in a quiet room by yourself, facing a wall, no idea what's going on, or if they forgot that you were even there. We've all had those experiences somewhere along the line in our lives. Versus someone who is making you feel like you're the most important person in that entire facility. That speaks for itself, and patients can see the difference. You don't have to do a lot to let them know that, good work and doing things the right way speaks for itself, and people realize it.
Okay. So what would you talk to somebody's a D4, somebody's coming out of dental school, they're D4 now. So right now we're talking, and it's mid-October. So whenever you're watching this person, our time frame, and they're saying, what do I do? What would you say to somebody that went to your school? Like if they brought you back to West Virginia dental school, what would you say to the class? What would be the 1 or 2 things you would make sure they understood?
Yeah, I would say, number one, you got to get your hands dirty, and you have to try as much as you can, anything that's at your disposal. And at West Virginia, particularly, there's not a whole lot that you can't get your hands on when it comes to dental procedures there, because you have to figure out what you like, what you don't like, what you're good at, what you're not good at, and what better time to figure that out when it's not under your license and and in your liability, but it's in a learning environment where if things don't go as planned, the consequences are a lot fewer than otherwise, when you're practicing dentist. And then that's the other consequence of that. If you don't learn those things in dental school, right, then it's outside of some really specialized CE, you're more or less not going to attempt to do anything that you're not confident and comfortable with doing. So got to get your hands dirty, number one, and do as much as you can, figure out the trajectory that you like to go in the dental industry. After that, go to a place that you don't want to be forever as an associate. And the reason why I say that is with restrictive covenants and things like that. If you love that place and you want to buy an office and be an owner there, well, with a restrictive covenant, that's going to be a lot more difficult to do, as opposed to, figuring things out and then taking all those experiences back to a place that you want to live full time. Right. So that'd be the second thing. Find a good associateship that you're going to have some guidance with. And a lot of them say that they'll have guidance and they'll guide you and they'll teach you and so forth and so on. And then it turns into, they don't have time. They're busy.
Yeah, they just put you on the assembly line, and that, that's great advice. I'm a little bit counterintuitive. The other that let's just explain to those who don't understand the restrictive covenants. If you're in dental school, when you come out and you become an associate, you're not going to be able to. You're going to sign an agreement, and it's going to prevent you from taking patients with you, usually, and working within a certain radius of that practice as part of the deal, which is a fairly reasonable thing to ask. There's very few associate agreements that don't ask for those two things. So they are restrictive covenants in the agreement. So very good little piece of advice. I haven't actually heard that. I really love that. It's like, don't do your associateship right where you want to work the next 20 years. Right. Because you won't be able to. You're gonna have to pick right outside where you want to work. So
exactly.
Well, Jordan, thank you so much. This has been a fascinating story, and I think there's so much for people to glean from this. And I look forward to seeing where you go from here, and when you start to incorporate more technology and face more challenges. Love to get you back on and do a checkup, do a exam and cleaning of your trajectory. So thank you very much for your time. I wish you continued success, and and thank you to your Fortune coaches that recommended to bring you on, because I think this just made a terrific show. So thank you. And I'll see you soon, I'm sure.
Absolutely. Thanks for having me on, Fred. I appreciate the opportunity. And any 6-month checkups you want to do, I'll make sure I'm ready for them.
Good. Yeah. I don't want you to go like 2-3 years without recall. So
just sounds familiar.
So everyone out there, if you like the podcast, share it, subscribe, and recommend it to people. And then the rest of the time, keep on becoming remarkable.